if President Trump had seen what I'm looking at right now, which is actually the investment statement that came from Arbutus's own SEC filings, where they announce the relationship between the lipid nanoparticle for mRNA injections and Moderna, and would have read it in the Arbutus SEC filing from 2018. If President Trump had known that there was a horse race in place for a quote viral vaccine sublicense, okay, that's unambiguous. I'm going to be unambiguous with this. When the University of British Columbia filed the first patents on the lipid nanoparticle technology, the company that was spun out of UBC was actually benefiting, and I'm being unambiguous in my statement, benefiting the nation of Canada and the University of British Columbia, both financially and otherwise, with a overt economic benefit for the promulgation of the technology, which actually was funded at the time by a finance group led by Sheldon Reed, who was the co-founder of Capital Energy Resources Limited, and an investor group that got together to put up a debt financing to take the company Inex and turn it into the company Techmira. And these are very important names to get everybody familiar with, because Inex was the holder of the rights to the lipid nanoparticle, which were all transferred to Techmira. And that was done around 2007. And the reason why this is important is during that same period of time, for those of you not familiar with my previous reporting, the NIAID, NIH, and the CDC actually all had run a series of experiments on SARS vaccines. The first vaccine that was filed for SARS as SARS was filed 3 days after the CDC filed its patent on SARS. And if anybody heard what I just said, you hear the impossibility of that being actually anything other than collusion, because if a patent on a gene sequence is filed one day and 3 days later, that very same sequence is already filed with a vaccine patent, you know that something is extremely wrong. The company that actually filed the patent on the first SARS vaccine was Sequoia Pharmaceuticals. And if you go back and you look at the relationship between what was going on with the U.S. efforts around Sequoia Pharmaceuticals, which is a company that came out of nowhere, suddenly capitalized, and not just capitalized, but they also mysteriously had a foundation as the company became into existence, which is its own very bizarre paroxysm. And what's even weirder is that none of the patent holders or none of the executives of Sequoia Pharmaceuticals had any background in respiratory disease research at all. So how they patented the vaccine for a thing that had been invented 3 days earlier is a bit of a mystery anyhow. But ironically, the vaccine efforts in the United States fizzled out because in 2007, going into 2008, a giant reorganization of the strategy around vaccines generally was happening at NIAID. And the decision was made to kind of pull the plug on the traditional vaccine platform and come up with alternatives. The reason why that's important is then we have the emergence of Vivek's involvement, but it happens on the back of a very bizarre press release that was issued on July the 15th, 2010. And I just want you to, I'll just read this. And for those of you who want to look, the title of the press release is Techmira awarded up to $140 million US government contract to develop RNAi therapeutic against Ebola virus. And then it goes on to say, Techmira Pharmaceuticals, which is TSX-TKM, a leader in RNA interference, RNAi therapeutics, today announced that it's been awarded a new contract with the United States Department of Defense Chemical and Biological Defense Program, CBDP, through the U.S. Army Space and Missile Defense Command. So you heard what I just said. Through the Space and Missile Defense Command, which is where you usually see RNA lab programs going on, right? That's my sarcastic editorial, sorry.
No,
to advance an RNAi therapeutic utilizing Tecmira's lipid nanoparticle technology, SNALP, which is stable nucleic acid lipid particles, to treat Ebola virus infection, which is lethal to humans. More than 15% of the estimated value of this award would be subcontract to U.S. businesses. Tecmira has filed a U.S. affiliated office in Washington State, et cetera, and it goes on. But you can pull up this press release, and there are a number of things quite alarming about the press release. But to be perfectly blunt, it is important to point out that Tecmira, the company that was ultimately the subject of Vivek's wealth, unambiguously stated that its sole purpose, its primary purpose, was RNA injectables. And those RNA injectables, I'm going to get to in a minute in another one of their disclosures, become extremely important to this narrative. So when Vivek yesterday on his video response to me said that lipid nanoparticles can be used for all kinds of things, I'm not going to debate the point that he's right. I'm simply going to say that the company he owned and the company he acquired unambiguously, and in this particular case with the largest revenue that it ever had, was a U.S. Defense Department contract for RNA injections, and specifically through the Army Space and Missile Command Defense Program. So this goes to the point, John, we were making before. If President Trump had any idea that that contract had been awarded in 2010, he might have taken a second look at why everybody was putting lipid nanoparticles and Moderna in the front line for this horse race. But let's take the story a little further. In 2012, there was another technology that was developed through a license from Tecmira. That license was updated on April the 2nd, 2012, when the FDA approved a drug called Marquibo, or MARQIBO. That drug was actually developed using Tecmira technology for a what's called a Philadelphia chromosome negative acute lymphoblastic leukemia, or ALL. And if you read the actual press release that was dated August 9th, 2012 about the FDA approval, it's actually important to understand that there was a fairly significant alarming note that was in that particular press release. And it says, and I'm quoting from the press release of August 9th, 2012, the safety of Marquibo was evaluated in 2 single-arm trials of 83 patients who received the clinical treatment regimen. Serious adverse events, such as low white blood cell counts with fever, low blood pressure, respiratory diseases, and cardiac arrest, occurred in 76% of the patients.
Wow.
Now, that's information that was in the due diligence dossier, which led to, are you ready for this? The March 4th, 2015 announcement that Tecmira was merging with none other than Vivek Ramaswamy's Encore Biopharma Inc. And most people don't know that the way he got into this was a merger of the company Encore Biopharma with Tecmira. That was a merger that was announced on March the 4th, 2015. And during that particular merger, they actually were specifically talking about the fact that they were going to use, and I'm quoting once again, this is a quote out of the press release of March 4th, 2015, Dr. Mark Murray, Tecmira's chief executive officer, and he's quoted as saying, Tecmira's unique business model combines multiple technologies and assets under one roof, enabling us to efficiently and rapidly evaluate a combination of therapeutic agents targeting multiple aspects of viral persistence. We intend to advance the most promising product candidates from our portfolio through clinical development as combination regimens and to combine to evaluate new opportunities to expand therapeutic research. Ironically, on the back of this, what we actually knew is that Vivek said the transaction creates a new company committed to delivering a cure for the global epidemic of hepatitis. Hepatitis B is what he said. It's mislabeled HBV, but it was hepatitis infection. We've assembled a world-class management team, board of directors whose achievements include developing a cure for hepatitis C, pioneering RNAi drug discovery and development, and creating significant value for shareholders. So that's the official statement that was made on March the 4th, 2015. And remember that we actually have, that's March the 4th. We then have on July the 20th, 2015, and this is where we get really alarming, that Techmira decided to change its name so that it would disassociate itself from the Ebola project that it received that $140 million grant from the U.S. Defense Department about just a couple of years earlier. Wow. Now, I don't know how many people are familiar with this, but last time I checked, if you have an open-ended $140 million contract with the Department of Defense and you decide to, quote, shift away from it, which is the press statement that was made July 20, 2015 at 9:47 a.m., Techmira said it's focusing away from its hepatitis B research, which would suggest, as I stated in my video, that somehow or another they're moving away from the thing that they were actually allegedly Vivek's stated interest was doing. They're going to move away from that, and they were going to actually move into focusing on other developments. So ironically, they're moving themselves into allegedly this kind of reordered strategy and reordered priority about 4 months after the merger starts. And then mysteriously in 2017, they are in litigation. February, the litigation goes on for quite a while, but on February the 7th, 2017, so two years after this shift of priority, they actually obtain an injunction from the Supreme Court of British Columbia. And this, by the way, is a press release, February 22nd, 2018. They obtain a injunction from the Supreme Court of British Columbia. And I want to read one section from the press release. This is Arbutus' own press release, February 22nd, 2018. The settlement terminates Acuitas. So Acuitas was a competitor of Arbutus that actually had some of the sub-licensing rights from Arbutus to actually develop a number of technologies. But the settlement terminates Acuitas' right to use or sub-license our lipid nanoparticle technology going forward, making permanent the effect of the court's prior injunction, said Dr. Mark Murray, Arbutus President and CEO. Arbutus lipid nanoparticle represents the most clinically validated delivery technology suitable for RNAi, mRNA therapeutics, and gene editing applications. Did you hear that last one? Gene editing applications. With the settlement of the Acuitas litigation, Arbutus has now consolidated the lipid nanoparticle intellectual property estate. This is a major milestone which established Arbutus as the owner and only source of this industry-leading technology platform with an ability to develop a full range of applications. And lo and behold, less than a year later, we have the announcement that the development of their technology is now going to be not only ongoing, but in partnership with 4 retained, and this is the last part of that press release, the settlement stipulates that the 4 non-exclusive viral vaccine sublicenses, you heard what I said, viral vaccine sublicenses, previously granted to Moderna, are the only sublicenses to survive. These 4 sublicenses previously granted by Acuitas to Moderna under the pre-April 15th, 2010 Arbutus LNP patent families are each limited to specific viral targets. Now, those targets were not mentioned. So I want to be clear. They didn't say what the targets were. But it's important to realize that this particular press release makes it abundantly clear that Arbutus is the beneficiary through a sublicense of Moderna's enablement to make any injection whatsoever. that was recited again in the financial statements of Arbutus in 2018, when it says unambiguously in their SEC filing, the settlement stipulates that the 4 non-exclusive viral vaccine sublicenses previously granted to Moderna Inc. are the sublicenses that survive. So they actually put it in the press release and then recite it in their SEC filing. And then shortly after that, Vivek decides to set up a company called Genevant. And Genevant is a company that was actually a very, very specific allocation of the RNA and mRNA technology uses of the lipid nanoparticle. And I just want to read for all of your benefit the actual summary of that, which is Genevant. Well, let's just go back one paragraph. This is from a press release in the Third World Network that was a August the 3rd, 2020 article by a gentleman by the name of Edward Hammond, which is Hammond. And in the article, he says I'll just go ahead and read 3 paragraphs. Adding to the complicated outlook, Arbutus has entered into separate deals related to the mRNA patent. After Arbutus, then Tecmira, Ebola drug sputtered and eventually flunked in trials in 2018, the company changed its focus to hepatitis B. When it did so, the Canadian company accepted a U.S. $116 million investment from Roivant Sciences, that's actually Vivek, based in Basel, Switzerland. The investment made Roivant the largest shareholder in Arbutus. Roivant then merged some of its own research programs with parts of Arbutus to form a new company called Genevant, which is based in Cambridge, Massachusetts. Genevant came away from the deal with assets that include an exclusive license for all non-hepatitis B use of the formulation patent, including the control over sublicenses. The only exceptions, according to the Arbutus filing with U.S. regulators, are the pre-existing patent licenses, one of which, interestingly, is held by CureVac, a German company, whose own mRNA COVID vaccine is competing with Moderna's. So, when I have said, and I just want to be really clear on this, when I have said that Vivek unambiguously made money on this campaign, what I am saying is unambiguously, he not only bought, but he bought for the benefit of a development program that unambiguously included Moderna and enabling the mRNA vaccine. That all is information that took place between 2017 and 2019. So this idea that somehow or another, by selling his interest or transferring his interest to go into the presidential campaign, somehow or another, he is absolved of participating in the profiteering on the back of a mRNA injection campaign that was predating all of the alleged knowledge of a potential outbreak of potentially SARS is ludicrous. He knew absolutely what he was buying. He knew why he was buying it. And he knew that and this, by the way, the Genevant press release that was part of the Arbutus release of the press release of the formation of Genevant, the press release, April 11th, 2018, Arbutus Biopharmaceutical Corporation and Roivant today announced that they've entered into agreement to launch Genevant, etc. It's important for people to read that the second paragraph of that press release says Arbutus will license exclusive rights of its LNP and ligand conjugate delivery platforms to Genevant for RNA-based applications outside of hepatitis B. Through its expert team and dominant intellectual property in RNA delivery, Genevant plans to develop products in-house and pursue industry partnerships to build a diverse pipeline of therapeutics across multiple modalities, including RNAi, mRNA, and gene editing technologies. That press release dated April 11th, 2018. Now, why are all these dates so important? We have to remember that specifically around the coronavirus narrative, it is critical to make sure that we never lose sight of the fact that all of the things that we're talking about and all of the things that happened since 2015 And this is the reason why pleading ignorance and somehow saying, well, I'm just an innocent investor who happened to own the company that enabled the death shot. That's disingenuous. Now, I'm not saying that you can't invest in a thing, and I'm not saying that you shouldn't invest in a thing. I'm simply saying, and by the way, I guess there'd be an argument that some people would make saying, well, at least he's using his ill-gotten gains for, whatever, trying to do something in public service. Come up with whatever narrative you want. My point is simple. The public needs to be informed of the fact that it is the occult and the hidden that is the enemy of democracy.
100%.
And when you have information where you pretend on the one hand to be the innocent, lucky, the lucky guy who caught the leprechaun holding the pot of gold called Takmira, which, by the way, if you look at the financials of Arbutus, you realize the reason I'm saying that he only profiteered on the back of the hype is because that's all there's been. There's not an economic model there that's worked. The things that they've tried have failed. In fact, you heard me read the 76% severe adverse event data. 76% severe adverse event. That's in your company. That's not a oops, we overlooked it. Right. So let's get really clear on the fact. My point is the public needs to be informed. And if you are going to try to take the mantle of leadership in any environment, then own what you have done. That's it. And then let the public decide. But remember that this is against the backdrop of published in 2016, February 12th, 2016, Peter Daszak, in concert with Ralph Baric and Anthony Fauci, discussing what needed to be done to drive a universal acceptance of a vaccine. Peter Daszak's quote, I'll read it to all of you so that you actually never forget it. Until an infectious disease crisis is very real, present, and at an emergency threshold that is often largely ignored. To sustain the funding base beyond the crisis, we need to increase the public understanding of the need for medical countermeasures, such as a pan-coronavirus vaccine. A key driver is the media. The economics will follow the hype. We need to use that hype to our advantage to get to the real issues. Investors will respond if they see profit at the end of the process. That is a quote published in the Proceedings of the National Academy of Sciences, February 12th, 2016. And why is that quote so stinking important? Well, if you go back and you look at the stock performance of the company that Vivek found his way accidentally into, lo and behold, around the time that the public was informed of the, quote, need for medical countermeasures such as a pan-coronavirus vaccine, I know this will come as a total shock to all of you, but for some mysterious reason, the stock of the company during that period of time went from about, I'm estimating because I'm looking at the chart, from somewhere in the neighborhood of $9 a share to $20 a share. Now, am I making an accusation that somebody profiteered? No, I'm making an observation. And I'm making an observation that does not happen in some sort of anonymous vacuum. So either we have one of two problems. Either Vivek did no due diligence on his investment and just is the luckiest leprechaun of all, or he did do due diligence and he knew that he was in partnership with defense contractors and Moderna and all of the nefarious actions at NIAID, and he profited from it. And I don't care which side of that coin you come down on, I think that's a material topic for somebody who says they want the mantle of leadership of this country. And that's just my opinion.